What is the most likely diagnosis in this patient? Hemophilia A, B, C, von Willebrand disease, or DIC? A 25-year-old man presents to the ED with multiple large ecchymoses and spontaneous nosebleeds over the past week. He has no significant past medical history, but reports that his maternal uncle experienced similar bleeding episodes. Laboratory evaluation reveals a prolonged PTT, a normal PT, and platelet count. Further testing demonstrates a deficiency in factor, I believe that's 11.
Mm-hmm.
Factor 11. Okay. So hemophilia A is factor 8. So I'm gonna get rid of that, and that's usually in children anyway, around the joints. Um, Hemophilia B is factor 9, and so I'm gonna get rid of that. DIC would have a complete, like everything's wrong, like you're clotting all over the place, and so I would get rid of that because you would have also prolonged bleeding time and or platelet count. You would have everything's wrong. I just think about like everything's wrong. And von Willebrand disease, I don't think this is the case because von Willebrand disease is just like you have an obviously von Willebrand factor deficiency, and the deficiency here is in factor 11. So I believe that's hemophilia C. It's been a while though, so I'm gonna say that's probably the right answer.
Yeah, good. So deficiency with 11 is hemophilia C, autosomal recessive, less severe than A and B, associated with family history of bleeding episodes. But like you said, A is 8, right? B is 9, right? Von Willebrand disease, just so you kind of remember that they can have a prolonged APTT also. Okay, that's something that you want to remember. They
But
like
that's
asking
because
for,
they stabilize factor 8, right?
yep, bingo.
Oh, there,
Um,
yeah, there.
Yep. I want you to remember that because they like asking kind of that trick question, right? And they're going to have increased bleeding time, right? Von Willebrand disease because it messes with platelet, I think, adhesion. And then DIC, usually they'll say like,
Yeah, adhesion.
some kind of viral infection or trauma or sepsis or something bad.
Or
And they
snake
call it
bite.
inciting factor, right?
Yeah.
So you get some kind of inciting factor. Same thing with a what is it called? Amniotic fluid
Fluid
embolus.
overload.
Yep. So then they're gonna bleed from every orifice, right? Spontaneous bleeding, right? Prolonged everything, bleeding time, decreased platelets, everything's messed up in DIC. So
Yeah.